and good afternoon, evening, morning, wherever you're watching from. My name is Ruth Montalvo and today we'll be discussing grief. Now, what is grief? Based on Cleavland Clinic and healthguide.org, grief is a natural response to a major event's loss. Now, it's when you emotionally suffer and cope when something or someone is taken away. Usually, it can either be through someone's death, a divorce, a relationship breakup, one's fertility, one's youth, and realizing that your goals or dreams are not going to be or are meant to be achieved. Now, there are 5 stages to grief. The first stage is denial. This is when you won't accept it. The second stage is anger. You blame others, you blame yourself, and sometimes people even blame God. The third one is bargaining. You try to compromise with yourself. You try to compromise with it. The fourth one is depression. Some people experience signs of depression, and one of them being emotional detachment. And finally, acceptance. This is when people accept the reality and embrace it, even if they're not completely over it. Now, at some point in our lives, will experience, or have experienced grief, and it's totally normal. There's a lot of resources that can help you cope with it and deal with it. However, it can affect your physical health, it can affect your sleeping schedule, your eating habits, and your overall health, depending on how severe the impact was. And people cope with grief differently. There are various ways in which people may be coping with it, and that's what we're going to jump straight into right now. Now, the first kind of grief is anticipatory grief. I hope I'm saying that right. But that is when you grieve before the actual loss. This can be when one of your loved ones is already diagnosed with a terminal illness and you're preparing yourself to grieve. You're making plans. You're putting yourself in that mindset that you're about to lose that person. It can be a job, it can be retiring. You're preparing yourself mentally to grieve with it, so once it actually happens, it won't be such an impact. It won't have such an impact in you. And then we have abbreviated grief. I hope I'm saying that right. And this is right after anticipatory grief. People usually get over it quickly because they've already prepared themselves for it, and they just get over it quickly. So it's just a follow-up after anticipatory grief. And then we have delayed grief. Now, delayed grief is different because it actually takes people days, months, weeks, or even years sometimes to grieve. Usually this is because they have either responsibilities that they have to take care of, like a funeral expenses, planning out other things, or it doesn't automatically hit them till they're over with their responsibilities. And then there's a second one where they're so shocked that they need to process it and then they grieve after it. These are just 3 ways that people experience grief. People experience grief in so many more different ways. There's a common misconception or a myth that people who don't cry aren't grieving, and that is totally false. As I previously mentioned, people experience grief differently, and just because you don't cry doesn't mean that you aren't grieving with it. And from what I got from my sources, is that you can find ways to cope with it, and the best way is to talk to someone. This can be a friend, a family member, attending therapy, and don't suppress your feelings. That's the best advice to grieving, and we all go through it at some point in our life. It can be manifested in different ways, but everything's fine, even if it's not. And thank you for listening to my video. Have a nice day. Take care. Bye.